Two thumbs up from the FDA and the CDC tonight. Both agencies have given the okay for booster shots for 16 and 17-year-olds. Just hours after the FDA gave its emergency use authorization, the CDC announced it's encouraging Americans 16 and up to get their boosters if it's been 6 months since their last dose. Our Shannon Clough got some sharper insight from USF Health's Dr. Jill Roberts. She answered questions many parents with 16 and 17-year-olds are wondering tonight. And she also gave us a sharper insight into what this additional group of Americans being eligible for the booster could mean for you.
First one, why should 16 and 17-year-olds get boosted?
After we get those first two shots, after a little bit of time, that antibody level just starts dropping and dropping and dropping.
Out of the 9.5 million Floridians who are fully vaccinated, nearly 2 million are between the ages of 12 and 19. Roberts says it's important for the teens who are 16 and 17 years old to get boosted. But why?
They're in the workforce, they're going to school, they're in all these different scenarios, in which case they can become pretty good spreaders of coronavirus.
Any reason people shouldn't get the booster?
That's highly unlikely.
Because of Delta, she can think of one reason.
The one exception I can honestly think of is if you already had a breakthrough case with Delta and your breakthrough case was within the last 90 days, your antibody amount's going to be still pretty high.
Another question is, where can teens get their shot? They can actually come to a pharmacy, just like here at Walgreens, which adults can do too. Roberts says this is really important for two reasons. One, pharmacists are giving the shots, which means more availability. And two, this will limit the number of kids going into a doctor's office. That's a place they're likely to come in contact with someone who is sick. Speaking of sickness, Omicron is on everyone's mind. So does this booster help protect against the new variant?
There's pretty good data that would suggest that 2 shots is not going to be quite enough antibody to protect against the Omicron variant.
Roberts says boosters can up your antibodies. And while she has a lot of the answers, there are still questions.
When people get Omicron, how severe is it going to be?
That is a question that is currently being studied. Right now, the booster for those 16 and 17 is an emergency use authorization. For full approval, that is up to the FDA.